Lungs are the most frequent sites of distant metastasis for osteosarcoma, wherein metastasectomy is typically used for local control. This study aimed to evaluate the impact of margin length relative to tumor size on local recurrence and survival in lung-limited metastatic osteosarcoma. Prior studies from our institution have shown that use of a dynamic ratio of the surgical margin relative to the size of the tumor portended improved survival outcomes in metastatic disease. We performed a retrospective review of 142 patients with 689 nodules who underwent pulmonary resection for metastatic osteosarcoma between 2000 to 2020 at a large tertiary care cancer hospital. When the patients were stratified by resection margin of less than 0.5, between 0.5 to 1, or over 1 centimeter, those with margins of between 0.5 to 1 and over 1 centimeter both had significantly longer times until disease recurrence. More pulmonary metastases were found to be associated with a higher likelihood of recurrence, while sex, ethnicity, and operative approach did not impact the recurrence risk. However, a resection margin to tumor size ratio of greater than 0.5, meaning a resection margin that was at least half the size of the tumor, represented the most significant negative predictor of recurrence. Kaplan-Meier analyses, stratified by resection margin to tumor size ratio of less than or above 0.5, showed that the patients with ratios of over 0.5 fared better in terms of both overall and disease-free survival, although the difference was more pronounced for the disease-free survival. Therefore, we advocate for obtaining a resection margin of at least half the size of the tumor when resecting pulmonary metastases of osteosarcoma.